Hello all, here I am today to talk about the endometrial cancer in young women. So what is this endometrial cancer in young women? So this endometrial cancer generally occurs, we have seen it occurs in the later parts of our lives, that is around 50 years plus when we have had our children and all. But sometimes it can present in early stages or early age, that is around 30s or 20s, 5 plus. So why is it so that endometrial cancer, which generally occurs in elderly age, is coming at the 25, 30s and all? So here we are to discuss about this today. So there are two reasons or two ways of looking at it. One thing is, we all know that endometrial cancers are related with hormones. So if a woman who has some hormonal imbalance may be at risk of getting these kind of cancers. And how is it that we know that yes, we have got endometrial cancer when you're 30 years and all? These women generally will have some problem with their periods. They may have very heavy flow which is not responding to the regular treatments given by the doctors, or they may have difficulty in conception, they are unable to conceive, and many women present to us with these problems, that is either a period irregularity which is not responding to hormones, or the ones that they want to conceive and some doctor had done a DNC and then they realized that there is some problem with the lining of the uterus. Any woman who comes to us with this diagnosis that yes, she has got an uterine cancer at an early stage or age in their life, then we always rule out this genetic element. The second thing that we do for these kind of women is that we will treat them not with uterus removal. Normally in cancer treatment, whatever is the affected part, we generally remove that particular part. Like uterus lining has got a cancer, you remove the uterus because we do not want any part of it being there. But here we are dealing with a woman who's got cancer in the uterus and she wants kids. So she wants to conceive. So how to go about it? So there is some type of cancers, which are the common variety of cancers, which generally a good variety, where we are able to give medicines, some hormone manipulation will be done, and some time we will gain. In the science, will buy some time for the women to reverse these changes that have happened in the uterus lining and see to it that she conceives. So these kind of things have happened in the past. World over, many doctors are practicing this, but the data is coming out because all these problems of women trying to postpone their pregnancy, trying to conceive later in life, and polycystic ovaries being there or endometriosis being there associated. So all this kind of scenario has changed of late for us all over the world, and here we see women who are in their 30s wanting to conceive, whereas the same thing around 30 years back, the woman would have completed her family by the age she attains 25-30. So this shift in our lives have made some stress in our lives, and this has caused some more hormones abnormalities and may be predisposing to these kind of cancers. So we need not worry that yes, there is a cancer diagnosed early, we need to remove the uterus. No, we can always buy some time and see. Doctors will assess and see that whether you have got the uterus, only the lining is affected by the cancer, or the muscle is affected by the cancer, or the lymph glands are affected by the cancer. First the doctors will assess and then they will counsel you. Majority of the times what we see is these women generally come early, so they will be, majority of the time, might be confined to the uterus lining only. Either it will be in the pre-cancer stage or in the cancer stage. So both the conditions we will be able to treat with some hormone manipulations. What we do for these cancers patients is, or pre-cancer patients, is to insert one Mirena and give hormones, anti-hormones in such a way, and that it regresses this endometrial lining. It sees to it the lining gets reversed back to normal endometrium what we see. So this we follow them generally, and then we do what we call hysteroscopy. That means put a tube inside the uterus and see with a camera what's happening inside the uterus. Take some biopsies. This is done every 3 months to see to it that the lining is turned back from cancer or pre-cancer to normal lining of the uterus, which should be there at this age. So once that much of time is once we spend that much of time on the women, generally around 3 to 9 months or 3 to 6 months, the women reverses this endometrium with these medications. Then we send them across for conception. So these kind of methods can be done. We need not remove the uterus just because you've got a uterus lining cancer, which is very early. So you can buy time. If you want, all these things are done by the doctors if the woman has a very strong desire to have their own children or bear their own children. So we can retain the uterus and give them the medication, buy time for her to conceive, and once pregnancy is done, then we ask them to remove the uterus, ovaries, tubes, everything to be removed, because that is what is the standard of care. So these kind of things can be done with complete supervision and knowing that yes, we are doing this to have a child. This is in discussion with the doctors who are treating you, and we take a step forward to buy time to have a baby and then remove the uterus, which is the standard care in these kind of cases. So here, women, girls and ladies, if a woman who is young and has got a uterine problem, you have to consult with a Gynaec Oncologist who is dealing with these cases of fertility preservation and then save your uterus for getting a baby, and post delivery you can get it out. Thank you.